Hello everyone, I am Dr. Anil Heroor. I am the head surgical oncology or cancer surgery at Fortis Hospitals in Mulund. We at Fortis Hospital conducted a very interesting survey on the occasion of this Cancer Day, which was on 4th February. Nearly 4,350 Mumbaikars were sought and their opinions were taken regarding cancer and cancer care. Very interesting findings came out, and out of the main things that we could learn was that 60% of the people who suffer from cancer do not want to discuss that diagnosis with their family. Now that's a very strange thing. You would expect that people want to take support, but that was the finding that came up in this survey, which means that people need to be more open. They have to be taught about cancer because they worry. And what do they worry about? They worry about their near and dear ones getting on the burden of their diagnosis. They do not want to share that burden. They do not want to trouble their near and dear ones. However, that has to change because cancer patients require a lot of empathy and support. The other thing that came out was that a lot of patients are worried about the financial impact of the disease. So I would think, and a lot of them, nearly 80% more, felt that there should be some kind of insurance that has to be made for cancer. This also resonated with the fact that nearly 1/3 of these patients felt that mental health support was a major issue during cancer treatment. Nearly 20% of them also felt that we need to have trained counselors in order to support this journey of cancer treatment, which I would completely empathize with. Cancer is a difficult disease. It's very easy for me as a doctor to write medicines and advise surgery, but for someone to actually accept that diagnosis and go through that treatment of chemotherapy and radiation and surgery is something really difficult, and definitely the services of a counselor will be most welcome, and that is what we are all trying to do in Fortis with the help of support groups, with the help of trained psychologists and trained counselors. The other thing was nearly 10% of them felt that there has to be some advice as regards nutrition. I was surprised that this number was just 10% because nearly all patients end up asking me what to eat and what not to eat. The role of diet is extremely important in Indian lives, but however, there is during cancer care, there is no such specific restriction in most cases, barring the usual adage of not going eating in outside food, roadside food, street food, for example, avoiding unhygienically cooked food, etc. Nearly 16% of them felt that financial support was required, and this also resonates with an pan-India study that was done, which said that nearly 40% of the expenses are out-of-pocket expenses, and people have to take loans to finance their treatment. So all this resonates with what is happening in the real world, and hence I think this survey was an important eye-opener for all of us at Fortis, and hopefully for Mumbaikars as well, as to how we should treat this dreaded disease coming forth.